Good morning and afternoon, everyone, and evening to some, and welcome to this ATS Pulmonary Rehab Assembly Journal Club. So my name is Paulo Ros Guerrero, and I'm a member of the Pulmonary Rehab Web Committee, and I'm a postdoc research fellow at the University of Newcastle in Australia. And I'll be moderating today's webinar with the help of Katie Manson. So before we start today, I just have some quick housekeeping notes. If you're not already on mute, please mute yourselves, especially throughout the presentation until we get to the discussion. This is just to ensure that the recording can be used for future viewing. So we'll start off with the presentation for 15 to 20 minutes at the start. And following that, I encourage some lively discussion after. And everyone is welcome to engage in the discussion by either leaving questions in the Q&A function of Zoom, which will be moderated by Katie. Or you can use the raise hand function and then I can call on you later to ask your question to the group. So today's our webinar is going to be on the paper Characteristics of Responders and Short and Medium-Term Effects of a Behavioral Intervention to Increase Physical Activity in People with Moderate to Severe Asthma. And this paper was published in JACI in Practice last year. We are lucky to have joining us today the first author of the paper, which is Fabiano Francisco de Lima, and the senior author also, Celso Carvalho. Serving as experts on the panelists, I'd like to welcome Roberto Benzo and Oliver Price, who will be joining in on the discussions. But without further ado, I'd like to introduce Joice Mara de Oliveira, a postdoctoral research fellow from the University of Newcastle, who will be presenting the paper today. So with that, Joice, I'd invite you to share your screen and start whenever you're ready.
Okay, so welcome everyone. I'm very happy to be presenting this paper here today to you all, especially because it's from a research group that I really admire. And Paola has presented me already, so I don't have to do this. Okay, so let's go to the paper then. So to start with, you know that people with asthma, they do less physical activity than healthy controls. And it is shown in these graphs by steps per day and minutes of moderate to vigorous physical activity. And we also know that people with asthma that engage in regular physical activity, they experience general health benefits, as the whole population does. Some studies have shown that behavioral intervention help to increase physical activity in this population. And they have also shown that in addition to increasing physical activity, they also increase asthma control, for example. But as always studies, that we have some non-responders to the intervention. So some people don't increase their physical activity levels with the intervention, and they also don't improve their clinical control. And another point is that the medium-term effects of and the responders' profile of this kind of intervention remain unknown. Therefore, the objectives of this study was to identify the characteristics of responders to a behavior intervention designed to increase physical activity in adults with moderate to severe asthma, and also to evaluate the functional and clinical responses to the behavioral intervention in the short and medium term. So they ran this prospective pragmatic study in São Paulo, Brazil, and the data collection was made between May of 2022 to December of 2024. They included participants who were 18 to 65 years old, who had moderate to severe asthma. They had partially controlled asthma or uncontrolled asthma assessed by the asthma control questionnaire. They should be under outpatient medical treatment for at least 6 months. They should have clinical stability for at least 30 days, and they shouldn't be physically active. So they measured their physical activity at baseline with actigraph, and they should be doing less than 150 minutes of moderate to vigorous physical activity per week and less than 7,500 steps per day. So in here we can see that they performed the assessments at baseline, 8 weeks, and 16 weeks after the end of the intervention. And the participants were assessed on lung function through spirometry, physical activity and sedentary behavior with accelerometry, asthma control with the asthma control questionnaire, asthma exacerbations, quality of life was assessed with the asthma quality of life questionnaire. Anxiety and depression was assessed by the hospital anxiety and depression scale. They also assessed the barriers to perform physical activity, the behavioral stage for physical activity, anthropometric data, and body composition through bioimpedance. Regarding the intervention, they delivered an educational program to all participants. So they had two 90-minute sessions of asthma content and also physical activity and sedentary behavior. And the behavioral intervention itself was according to the trans-theoretical model. They had motivational interviewing. They gave feedback to the participants. They also discussed about the guidelines for overcoming barriers to physical activity. And the participants were in a smartwatch activity monitor, the Mi Band 5, that vibrates when the recommended daily number of steps is achieved and if the individuals remain sedentary for 60 minutes. So they had 8 weekly face-to-face individual sessions that lasted up to 90 minutes.